Hello and welcome to our Be Empowered education series. My name is Aubrey Merrill. I am our oncology coordinator here at the Sarah Cannon Cancer Hospital at Medical City, Plano. I'm excited to introduce our speaker today, Cynthia Cervantez. Cindy has worked for Cancer Support Community North Texas since 2013. She worked as program manager at the Tarrant County Clubhouse until 2018, at which time she accepted the position of program manager at the Tarrant County Clubhouse. At which time she accepted the position of program director for all North Texas locations. Prior to joining Cancer Support Community North Texas, Cindy worked for more than 11 years with at-risk children and young adults in the foster care system. She holds a master's degree from the University of Arlington and is a licensed master social worker. I do want to let everyone know we are recording this today because we're hoping to post this perhaps on YouTube or some other social media so that we can help the public long-term have access to this information. We ask that if you have any questions during the presentation to put them in the chat box at the bottom right of your screen. And as the presentation goes along, I'll either ask Cindy or I may hold them for the end depending on the type of question you have. And Cindy has prepared an informative seminar for us today. And again, if you have any questions, put them in the chat box. And with that, I'll turn it over to Cindy.
Thank you. Again, I'm Cynthia Cervantez, and I am with Cancer Support Community North Texas. And today we're going to be talking about what do I tell the kids. This is a Frankly Speaking About Cancer series, and it's made possible by an anonymous donor. So we thank the person who made this possible for everyone. Just a little bit of an introduction about cancer and kids. Cancer affects a family in many ways. Every family member's experience is unique and different, often making it hard to know how to provide support to one another. There are changes in day-to-day routines and more responsibilities to be managed. Feelings of anger, sadness, helplessness, regret, and fear may touch different family members at different times, making life unpredictable for everyone. When someone in the family has cancer, it's normal to focus attention on that person's medical treatment and their well-being. Many parents try to protect their children by not sharing information about the situation. We don't often realize that even if they're not told about cancer, children of all ages can feel the impact of an illness on the family. So a brief overview of what we're going to be talking about today. We're going to be talking about what kids understand, talking about cancer in general, tips for answering questions that your children have, ways that you can help your child through the cancer journey, answer any questions at the end that you might have, and provide you with some resources that may be beneficial for you after we're done here. So, what kids understand. The developmental understanding of children is going to vary depend based on the age of the child that you're talking to, but children understand things at different levels, and not always their chronological age. Some kids are more advanced than others, and may understand even at a very young age more than you think they do. So with that said, we're going to start out at a little comment here that was made by a patient. She said, I feel things need to be approached differently for different kids and their personalities. It's not a one-size-fits-all thing, even with siblings. Kids should not be forced to act, feel, etc. in a certain way. This was a mother and a breast cancer patient. So we're going to start out with from infancy to toddlerhood. That's 0 to 2 years. What they understand at that age is very little. They know nothing about cancer. They are able to sense changes in a normal routine in the household, and they may be aware of changes in behavior and the feelings of the people that are around them, their caregivers, their parents, their siblings. And when we're not making the children aware of what's happening, they can act out in certain ways. At this age, they tend to throw tantrums. You'll see changes in eating and sleeping patterns, and they may experience some separation anxiety. Preschool 3 to 5 years, children understand simple illness like a cold. Nowadays, COVID, everybody knows about COVID a little bit. They have a little understanding of serious illnesses like cancer. but they tend to still have some magical thinking about how things happen and how people get better. Some common behaviors and feelings that are associated with this understanding. You may see some regression, bursts of emotion, repeated questions about what's happening in the household. Again, separation anxiety, and playing or acting out themes related to whatever illness is in the home. And then school age, ages 6 to 8. Children at this age group can usually understand the differences between simple and serious illness. There's some misinformation. Kids talk to one another and they share whatever they think their knowledge is of certain things. And they also engage in magical thinking at this age. Some common behaviors and feelings that are associated with this is regression, worry and fear, repeated questions, separation anxiety, playing and acting out themes related to illness, anger if their routine is disrupted, and distancing themselves. You're seeing kind of a pattern here. We're adding on to some of the previous common behaviors and feelings. They don't go away as they age. We just add more on. Okay, so then in middle school, which is 9 to 12 years old, children have a basic understanding of cancer. Still some misinformation going on here, magical thinking. Some common behaviors and feelings at this age are they hide their feelings. They develop worry and fear about outcomes. They have a lot of anger if their routine is disrupted. They express fear and sadness as anger, and they get embarrassed easily. And then teens, 13 to 18 years old. Some common behaviors and feelings include wanting to, they're struggling with that independence versus staying close to a family unit. Anger if routine is disrupted. They tend to hide their feelings and take out frustration and anger on family because that's the safe place. The term, you're angry at your boss and you go home and kick your dog. This is kind of what happens with teenagers. What they understand, their basic understanding of most illnesses, they have some misinformation here, and they begin thinking more about life and death and the meaning of life. So it's important to understand that when we talked about some of the things that children notice, the fact is that even if your child doesn't know about a cancer diagnosis, they usually know something has changed. They sense your feelings through body language and conversation they overhear. They notice changes in day-to-day routines, and they may be observing physical changes in the person living with cancer, such as weight loss, exhaustion, hair loss. And often if adults in the family aren't talking openly with the kids in the house, they may not feel comfortable asking questions about the changes that they see taking place, which in turn leads to them keeping their thoughts and feelings inside, often fearing the worst. So by having a conversation with your child, you're letting them know that they're an important member of the family and that you're giving them permission to have and to express the feelings that they have and ask any questions that they may have regarding the illness. So I encourage you, before you have this conversation, to prepare yourself for it. Before talking to your kids, prepare yourself for possible questions or feelings that the child may have. Also be aware of feelings that may come up for you during the conversation. It's going to be a difficult conversation to begin with. Most people who have cancer or are the caregiver of someone who has cancer, they have a lot of feelings of their own that they haven't dealt with, and oftentimes tears will bubble up, and so you just need to prepare yourself. While you may expect that your child will be very emotional and have many questions, it may be more likely that they remain quiet and have very little response at the time. Let them know if they have any questions and they want to talk later, that they can come to you then. Also, I want to talk to you about the timing of conversations. You know your child best, and you probably know the best times to have important discussions with them. It can be helpful to avoid having conversations with your child when they're hungry or tired, stressed out, or when there could be interruptions like television or cell phones and email. So while your talks will probably be short, it's best to time the conversation when you're not going to feel rushed. So depending on your child's comfort level with direct conversations, it may be helpful to talk with them with direct eye contact and where, or actually without direct contact. So like if you're driving in the car and everybody's a little distracted, but there's no radio on, they're not using their phone, but you've got them as a captive audience there, it may be a good time so they don't feel too much pressure from you staring right at them. Talk with your children in these situations may not put as much pressure on the child to respond immediately when you're in the car or something like that. So what type of language should you use? Try a calm voice and use clear and simple words to state the facts. You don't want to use confusing oncology terms. I don't know if you want, some parents want to talk about the cancer, some may just want to say they have a serious illness. So you need to choose your words wisely, but make sure that they're understandable for whatever age your child is. Use appropriate words like cancer if you choose, chemotherapy and radiation, but don't go into the specific types. This gives your child the language they need to think about and understand what's happening so they can ask questions later. Children's books can also be wonderful tools for adults and children in finding words to talk about cancer. These books don't have to be about cancer, but can be more generally about change, illness, or loss. It can be helpful to check with a children's librarian at your child's school or the public library for suggestions. You can also reach out to Cancer Support Community North Texas. We have books that we can provide to you free of charge if you're needing some helpful tools when you have the difficult conversations with your kids. All right, so let's talk about physical presence. Even when communication may feel strained and difficult, parents can help to create a comforting and secure environment just by remaining close by. Whether it's sitting quietly together, reading books, or being in the same room during homework time, your physical presence can send a message that you're here for them. And over time, this presence may generate more conversation about the illness. Our research showed that 66% of parents answering a cancer support community survey said that their children did not talk openly with them or share their feelings about cancer. So it's really important that you take some of the keys, terms that we talked about here, some of the advice about when and where and how to talk to your kids about this so you can open that line of communication with them. So here's some key points. Things that can be helpful to share with kids of any age. Tailor your message and language to your child's level of understanding. And remember that even children of nearly the same age might need different language and have different questions. So one example is, cancer's not your fault. Oftentimes kids think that they did something wrong and that's why mommy or daddy got cancer. So it's common for children to think cancer is their fault. However, they generally will not share this with others. By explaining that cancer is not their fault, you can help the child to feel less guilt and stress about the cancer diagnosis. Let them know that any question is okay. Children may be afraid to ask questions if they've not been given permission. Let them know that any question is okay and that you will do your best to have an answer. There may be times that you don't know the answer, and that's okay too. You just tell them, I don't know the answer to that, but I'll find out if I can and get back to you. Cancer is not contagious. Many children think cancer is contagious and become fearful of hugging or kissing their family member. Let them know that it's okay to be close and that they can't catch cancer. Some common questions and tips for answering questions that they have. It can be helpful to prepare yourself for some questions that children commonly have about cancer. Whether or not these questions are being shared out loud, they are often on their minds. Think about possible answers so that you can be prepared when they come up. So what is cancer? To answer this question, you can start with the basic makeup of the human body. For example, the body is made up of cells Normally cells are healthy, but sometimes there are unhealthy abnormal cells that grow the way they're not supposed to be. This is called cancer. Once there's a basic understanding of cancer, you can go into detail on what part of the body is affected by the cancer that you have, such as lung or breast cancer. Can I catch cancer? Many children, even teenagers, think cancer is contagious. Because of this, they may choose to distance themselves from the person with the disease. To help children understand, you can explain that cancer is not contagious like a cold or flu. You can teach that they cannot catch cancer, and you can't get it from hugging or kissing someone or for sharing their food or their drinks. Oftentimes they'll ask, what is chemotherapy, radiation, and surgery? Cancer treatments can often seem like a mystery to children. You may go in for a treatment and then come home feeling worse because of the side effects, and this can be very confusing. When you talk to your child about treatment, try to include some of the information on possible side effects the doctor has shared with you. This can help prepare the child for what he or she may see in the future. And here are some possible ways to explain common cancer treatments and side effects. Chemotherapy is a medicine that attacks cancer cells. Chemotherapy is very strong and can sometimes cause the person taking it to feel sick and tired. Radiation therapy attacks cancer cells. It is similar to an X-ray and targets the area with cancer. I cannot feel the radiation when it's happening, but it can cause me to feel tired afterwards. Surgery is when a doctor will surgically remove an area where cancer is located. Sometimes someone with the cancer will have a type of treatment, and other times they will have a combination of treatments, including chemotherapy, radiation, and surgery. So with a lot of chemotherapy, people lose their hair, and this can be a very scary thing, especially for young kids. So oftentimes kids will say, why are you losing your hair? Hair loss is one of the most obvious side effects of cancer treatment. Many children think cancer causes hair loss, and they don't understand that it's actually the medicine that causes the hair to fall out. One way to explain this is by talking about how the medicine is so strong that it attacks the normal cells at the same time as it attacks the unhealthy abnormal cancer cells. Hair is made of normal, healthy cells, so sometimes people living with cancer lose their hair. Explain that eventually the hair will grow back. This is often something that children wonder about. We have some great books at Cancer Support Community about the whole hair loss thing and helping kids who are in grade school kind of tell their friends. They become embarrassed when their mom they may be embarrassed when their mom comes and picks them up from school, or their dad, and they've lost their hair, more frequently with women than men. So there's a great book that we can share with you if you're interested on how to approach that topic. A big question that kids have is, do people die who have cancer? And are you going to die? What's going to happen? These can be the hardest questions to hear your child ask, and surely the hardest questions to answer. Your answers will depend on your personal cancer experience. However, many find it can be helpful and hopeful to be honest with your responses. Chances are your child will hear the other people that they know have died from cancer, and perhaps they even know someone who has died from cancer. One possible response may be, people can die from cancer, but many people live. My doctors are doing everything they can to get rid of my cancer. That's why I'm at so many doctor's appointments and have so many visits to the hospital. Right now, they think that the medicine is working, but if that changes, I promise I'll let you know. Children want to know that when there's a change. You won't want to keep it from them, and try to update them on what's appropriate to share and when it's appropriate. They also worry about what will happen to them if their parent dies. They wonder about who will take care of them and their basic needs. It can be very helpful and reassuring to let your child know who would take care of them if something happens to them, and remind them of the people in their life who care for them. Another big question that kids want to know is, can I talk to my friends about this? Sometimes families may choose to make their experience with cancer very public, while others may choose to keep it private and only share with immediate family. Based on what the family does, children may feel very comfortable talking with others, or they may feel that they have to keep everything a secret. Even if your family chooses to be private, it can be helpful to allow a child to have at least one or two people that they're able to reach out to and talk to about their feelings. Talk to your kids about some people in their life that they can talk to if they want to. Open communication, keeping your child informed, even if there has been no changes. Let them know that you're not hiding anything from them, and you'll include them when there are important things that they need to know. Okay. Some tips and tools that I kind of already walked through these. All right. Some ways that you can help your child. Some tips and tools. We'll talk about some feelings that they may have, their routine, and then some outside support. When looking for ways to support your child, some basic things that you can do to help them through the cancer experience, both at home and in school, include the following. Their feelings. Once you begin talking to your child, you could begin to introduce tools that may help them to deal with their cancer experience. Keep in mind that your child is probably looking to you on how to react and respond. If you share some of what you feel with your child, they may feel comfortable doing the same with others. It will also be helpful for them to understand that many feelings, including anger and worry and sadness, are very normal when someone in the family has cancer. Expect that your child may have a range of feelings that may come and go very quickly. It can be helpful to let them know any feelings that are okay. For example, let them know, rather than saying, don't cry, it's all going to be okay, you might say, it's okay to cry. Can you tell me how you're feeling? Your routine, try to maintain your family's normal day-to-day life as much as possible. This may be very difficult, and you might want to ask for help from family and friends. Encourage your child to continue with the favorite activities. These activities might end up being helpful ways for them to express themselves and allow them to have some normal.
Hey, sorry to bother you.
When so many things in their life are different. Allow for creative ways of expression, such as journaling, art, music, and sports.
Okay, because I put in the information on this patient. This is such a pain in the butt. I put in this information.
There's
for
someone
this patient.
unmuted.
I've
Hang
had
on
lots
one
of
second.
communications, and it comes back with an error.
Okay, got it. Sorry about that, Cindy.
Aubrey, now we cannot hear her.
Okay.
We cannot hear her.
Yeah, sorry, I'm trying to unmute. Hey, Cindy, are you able to unmute on your end? It won't let me unmute you.
I don't know how I got muted. I wasn't on the screen. Okay.
Yeah, you're okay. I can hear you again. Sorry about that, guys. I had to mute a couple people that were in the background. And I think
Okay, so let's talk about sticking to the rules. It's easy to stretch the rules when cancer is in the family and make up for what everyone is going through. Kids have a tendency to know how to work their parents as well. It doesn't matter if there's an illness in the family or not. They know when they're able to get away with things a little easier than normal. Keep in mind, however, that this may be the most important time to stick to the rules. We put rules in place to keep our children safe and to keep their lives stable. By sticking to the rules, you show your child that you will continue to keep them safe in a time when things may be out of control. And allow them to help. Just as adults do, children may look for ways to help. If they show an interest in helping, you might suggest some small things they can do, like making food, cleaning up their room, making a card. Try to be aware, however, of how much your child is taking on, especially older children. It can be easy and often necessary to ask our teenagers to share the adults' responsibilities such as cooking and cleaning. Teenagers can take great pride in helping their family. However, taking a role of a parent can be very stressful. Try to find a balance for them in their responsibilities because they still need to be a kid and take part in normal activities. And then at school, while cancer can be a very private family matter, sharing information with your child's school provides them with extra support when they are away from the home. You can ask your child when they feel comfortable talking to school and encourage them to check in with that person. Not only can the school provide support, but they can also let the parents know if they see any changes in the child's behavior. It's not uncommon for kids to start behaving differently in the classroom. When cancer is in the family, some common behaviors include forgetfulness, sleepiness, poor communication, irritability, hyperactivity, acting out, controlling behavior, and physical symptoms such as headaches and stomach aches, resulting in frequent trips to the nurse's office. Okay, so for outside support, we have this Frankly Speaking About Cancer book that's available. You can go, there's a link to the PDF down here on the bottom of my presentation. If you're not able to click on the hyperlink from the recording, you can go to cancersupportcommunity.org and just type in, what do I tell the kids? And there will be a place that you can download the PDF. Or you can ask for one to be mailed to you at no charge. Some outside support may be important if you notice your kids' behaviors are becoming concerning. So know that there are support groups that can help. We have them for kids at Cancer Support Community. We have a, we have a Teens Talk, which is basically a kind of open format. It's a support group for teenagers ages 13 through 17 who have a parent or a loved one with cancer or who have lost a parent or loved one with cancer. And we also have a Grief Busters for kids who have lost a parent or a loved one to cancer who are ages about 5 to 12. And we have a special workshop of 6 weeks for kids who need to learn more about cancer, and we will do some guided imagery with them. We do some art therapy. It's a great way for kids to learn about cancer in a safe environment around age-appropriate peers who are also going through the same thing. Some additional resources that you may or may not be aware of include Camp Kesem. At the back of this Frankly Speaking About Cancer book, the resources are all listed. We have a Camp Kesem here locally, but they're also nationwide. So if you happen to be viewing this and you're not from Texas, you can go out to their website and find a camp that's near you. Cancer Care offers telephone, online, and face-to-face counseling, support groups, and educational programs and publications. And Children's Treehouse Climb program. The Children's Treehouse Foundation trains hospital staff to offer support groups for children whose parents have cancer. There's also a lot of, nowadays, a lot of groups on Facebook that are closed groups for parents who have cancer and are wanting to talk to their kids. There may be some groups on there for teenagers to get involved with. So there's a lot of ways that you can find some additional information. We also have a CSC Radio Show. This link here will take you to our old CEO of Cancer Support Community. She has since left us, but it's a fabulous presentation on Frankly Speaking About Cancer. What do I tell the kids? I encourage you to go out and take a peek at that. And then the Cancer Experience Registry is a part of the Cancer Support Community. And this is a way that you can help others share the load that you have. It's a cancer-specific program that you share your cancer journey and your experience, and they can provide resources at the end for you based on your input. Okay, questions. I don't know if any came in through the program. Aubrey, do you have any questions that anybody has?
Yeah, a couple came to me privately.
Okay.
If a sibling has cancer, would you recommend using these same approaches to talking about the diagnosis?
Yeah, absolutely. And the children's hospitals have some great support groups as well for siblings with cancer. It can be extra confusing for kids when they have a sibling with cancer because their brother or sister is getting generally a lot more attention. They spend a lot of time at the hospital because it's the safest place. So when they're going through treatments, oftentimes they'll be hospitalized for long periods of time. And one or both of the parents are spending a great deal of time with the other child. So yeah, these would be great tools to use, same type of conversation, but I would also encourage you to have the parents connect them with their cancer support groups within the hospital system that they're in.
And another one was, as a parent, should you take your children to your cancer appointment so that they can hear firsthand from the physician what's going on?
That may be a conversation you want to have with your doctor beforehand, because I think it would really be dependent on what's going to be shared at that particular appointment. I mean, there is such a thing as saying too much in front of a child. You don't want to freak them out. So I think it would be okay if you had a conversation with the doctor ahead of time stating that you'd like to bring maybe an older child. I wouldn't say a very young child. But if you have a teen or a preteen that is interested in knowing more about the cancer from an actual doctor, I think that would be perfectly okay. But let them know you're bringing them so they're prepared to answer questions appropriately.
Mm-hmm. Well, and I could see too, maybe it's beneficial to ask your child, if that's something they're interested in as well, if they, would they want to go with you. So.
And it may be a good conversation. The physician's assistants happen to be really great at, communicating. Sometimes the doctors are short on time and the PAs are a little more generous with their time.
Mm-hmm. Makes sense. And as a heads up to everyone, I did put in the chat box while Cindy was speaking a link to that "What Do I Tell the Kids" PDF file she was talking about, and then the Camp Custom file. But of course, if you have any questions or concerns, you can always reach out to me through my email at Medical City, and I'm happy to get you connected with Cindy and get all the resources you need. I'll give everyone another minute or so to type any last minute questions you may have into the chat box. While you're doing that, I just want to say thank you so much, Cindy, for joining us today. This was very informative. I know I learned a lot. Always a difficult conversation for patients to have, and a lot of times as nurses, we are helping to support the patient. So we really appreciate being here.
Well, and I'll tell you what. Thank you too for having me, Aubrey. When we're back in person and we have the luxury of being in the same room, this would be a great presentation to do with a group of parents, where they actually have the workbooks that they can go along, and we can stop and we can process with families together in the room. It's a little more difficult this way when you don't have a captive audience.
Right.
I don't know if we have any parents who on the line who are going through something similar as to what we discussed today, but it's extremely helpful when you have a group of parents together.
Mm-hmm. At the moment, are those type of programs offered in person at Cancer Support Community?
Not yet. We're still, we are offering limited services in person, but they're just support groups, individual counseling, and some onboarding processes, probably through the end of the year. I would suspect that once the booster shots are open for everyone to get, that in January we'll be a little more comfortable opening up all of our service line. The rest of our stuff is available online through Facebook.
Yeah. No more questions came in. I did want to give everyone a heads up. If you were on the line today, I will send you out a link to a SurveyMonkey just to get some feedback on what you learned today and what future topics you may be interested in. I want to thank you again, Cindy, for taking your time with us today on your lunch break. and everyone for joining us. And if you have any follow-up questions, feel free to reach out to me, and I will get you connected with whatever resources you may need. Thank you.
Thanks so much. Bye-bye.
Bye.